Okay, so let's talk about some heart anatomy and coronary circulation, which is blood supply to the heart tissue itself. So, as far as where the heart is located, the heart is located in the region called the mediastinum. And so, this is not a cavity, it is technically a region, so not a cavity per se, but it's basically this region here. If we look kind of in between the two lungs, we have this area here, and we've got some vessels here. We would also have trachea and esophagus that are traveling through the mediastinum, and this is where the heart is located as well. So it's basically this region in between the two pleural cavities. Okay, the heart is about the size of your fist. So if you were to make a fist, that would give you an estimate of how big your heart is. It weighs less than a pound, which is amazing considering all of the things that it does for us. And it's angled towards the left. So it's got like this larger kind of, we call this the apex of the heart. So this pointy part kind of angles down towards the left. It takes up a little more space on the left. And for that reason, the left ventricle kind of protrudes a little bit further to the left of midline, and it kind of takes up some space for the left lung. So as a result, the left lung is smaller than the right lung, and actually has one less lobe. So we'll talk about that when we do respiratory system too. The heart is located in the pericardial cavity, which is located within the mediastinum, which is the region. Okay, so anatomists like to name all kinds of things, so I know that can get confusing, but the pericardial cavity, if you think back about the cavities that we talked about in the beginning, it's one of the ventral body cavities, right? And so this one is specifically going to be pericardial because it's the heart. Okay, and we're going to talk about that a little bit more. The heart in general has 4 chambers. So it's got a left and right atria, which are going to be the 2 chambers on the top. And they are called receiving chambers because they're going to receive blood from either the body or the lungs. Okay. And then we've got ventricles. Ventricles are going to be the 2 chambers on the bottom, and these guys are larger and they have thicker muscular walls because they are going to pump blood. So the ventricles are the pumping chambers, and they are either going to pump blood to the lungs or the body, depending on which ventricle we're talking about. Okay? The heart also pumps blood through 2 different circuits. So we have a pulmonary circuit, and whenever you hear the word pulmonary, it should bring to mind lungs. Okay? So we've got one circuit where blood is leaving from the right side of the heart, and it's being pumped to the lungs. Okay? So here we have oxygen poor blood traveling to the lungs. Here it's going to pick up oxygen, and now we've got to get it back to the heart so that it can be pumped out to the rest of the body. Okay, so the pulmonary circuit is going to be responsible for carrying blood to the lungs to pick up oxygen and then back to the heart again. And then we have the systemic circuit. And so systemic, you should really think about as the body. Okay, now at this point, we've got fully oxygenated blood, and we need to have a way to get it to all the tissues in the body. And we're going to do that through our systemic circuit. And so that's what we're looking at down here, as blood's going to leave the heart and it's going to travel to all the tissues in the body and supply those tissues with oxygen, and then pick up excess carbon dioxide that's given off as a metabolic waste product and return that to the heart. Okay, so that's our systemic circuit. So 2 circuits, pulmonary for lungs and systemic for the body. Okay, and here's your 4 chambers, basically stacked up. So right atrium, right ventricle for the right side of the heart, left atrium, left ventricle on the left side of the heart. Okay, let's talk about coverings of the heart. So the heart is covered in a double-layered sac called the pericardium. And so this is going to be really the most external, covering of the heart if we talk about it in terms of different layers. This is the most superficial or the most external layer. This is made from a fibrous pericardium. It is actually dense connective tissue. So if you think about it, think about other structures in our body that are made out of dense connective tissue. So we're talking capsules of joints, ligaments, tendons. Think about, are those structures stretchy? And they really aren't. So dense connective tissue is pretty unforgiving. It is not stretchy. And so this fibrous pericardium that covers the heart, it kind of covers it loosely. So it's kind of loose fitting and just lays on top of it, is not stretchy. And so it's very protective. Okay. And that's what we have there as our most external layer. Now, if we go deep to that, we have the next layer, and this is going to be our serous pericardium. So if you remember when we talked about body cavities, serous membranes are located in ventral body cavities. Okay, so just that's something that we've learned before, and so this is going to be a specific example of that. So we have serous membranes that are located in ventral body cavities. We know the heart is located in the pericardial cavity. This is one of the ventral body cavities. And it's going to have a serous membrane associated with it. So it's going to have a double-layered membrane. We know that all serous membranes are, they come in two layers. They have a parietal layer that lines the cavity that the heart or the organ resides in. And then we have a visceral layer that lies right against the organ itself. Okay? And that's exactly what we have here. So our serous pericardium forms the sac around the heart. The parietal layer is actually going to form or line the internal surface of this fibrous pericardium, because this is our most external layer. You go one deep to that and you're now into parietal layer of the serous pericardium. And then the next layer is going to be the visceral pericardium. And this is actually the outermost layer of the heart wall, otherwise known as the epicardium. Okay, so visceral layer and epicardium are synonymous. They are the same layer, they just have two names because anatomists like naming things, different things a lot. It's very exciting. And we also know too that between the visceral and parietal layers, we have a layer of serous fluid, right? And so that's going to happen right in between those two layers. So if we take a look at it, this is basically what we have here. Here is a cross section. So we've taken a piece of heart and we've actually pulled out a little piece there so we can highlight it. Showing you on the outside here is the fibrous pericardium. Okay, that's what this would be. This would be fibrous pericardium. And if we look here, this is going to be our outermost layer here too. So fibrous pericardium. And then we go the next layer in, and that's going to be this layer right here. This is going to be the parietal layer of our serous pericardium. Then we're going to have our fluid, which is going to be here, our serous fluid that happens to be located between parietal layer and visceral layer. So now our next layer in is going to be the visceral layer of the serous pericardium. This also forms the most external layer of the heart wall, okay, so otherwise known as the epicardium. Okay, so the most external layer of the actual wall of the heart. Okay, so just as a reminder, between the visceral and parietal pericardial layers is the pericardial cavity, or this kind of space that's filled with fluid. And if you remember what we talked about before, the serous fluid is there to reduce friction. So if you think about it, your heart's beating like 70 times a minute. And if it has to overcome friction with every heartbeat, that's taking up a lot of energy. So we want to reduce friction as much as possible. And so we have serous fluid that you're gonna see in between those two layers, kind of surrounding the heart. Now we get to layers of the heart. So this is actually like, not a covering on around the heart, but actually if you cut the heart open and you looked at the wall of the heart, it's going to come in 3 layers. And this is pretty typical of what you see in anatomy. Most structures are in 3 layers. So we have an epicardium first, and we're already a little familiar with that because that is otherwise known as our visceral pericardium. Okay, so that's going to be the most external layer. The middle layer tends to always be a muscle layer, and that's what we see here. Myo means muscle. Okay, and so this is our cardiac muscle. And if you think back, we had 3 types of muscle tissue. We had skeletal, we had smooth, and we had cardiac. So remember that from when we talked about tissues. And then the most internal layer is going to be endocardium. And this is a sheet of squamous endothelium, and it's resting on a thin layer of connective tissue just to provide it with some stability. And this squamous endothelium actually is going to leave the heart and become the endothelial lining of blood vessels. Okay, so it actually is continuous with that endothelium of blood vessels, which is ultimately going to form the tunica intima layer of blood vessels. Okay, but we'll get to that when we do blood vessels. So 3 layers of the heart. So if we were to back up, I just want to point this out on this image here. Here is our epicardium. So this kind of area through here would actually be the heart wall itself. So our most external layer is going to be the epicardium here. Here's our muscle layer here, nice and thick. Because heart muscle hypertrophies or gets bigger just like your biceps do when you work them out. And that's what we see here. Myocardium is nice and thick. And then our inner layer here is going to be our endocardium. Okay, so there's your most internal layer. So 3 layers of the heart itself. Okay. So let's talk a little bit more about the myocardium because this is the fun part. Myocardium is the contractile layer. Again, this is the muscle layer, and so it's made up of cardiac muscle fibers. And the way that these are arranged is that they're kind of bound together in bundles. And so the cells themselves, the cardiac myocytes, are attached by connective tissue and are arranged in bundles. And so it kind of like loops around the heart and then kind of down around the ventricles. And so as the heart contracts, it basically adds strength to the heart. It kind of holds everything together, and it's almost like it's squeezing the heart. And so that's how the heart contracts, is through these bundles, and they're all going to contract together at the same time, and it's basically like a squeezing type of contraction. So if you can kind of think about it, squeezing, and then it's going to send blood out, from the ventricles to either the body or the lungs. Okay, so I've pulled up the high-resolution heart image from the Anatomosh table so that we can look at some of these structures using these images. So we've talked about how there's 4 chambers of the heart, and we can see on this image a right atrium with the right auricle protruding superiorly from that right atrium. I always describe this in class as a little pig's ear. Just underneath the right atrium is going to be the right ventricle. If we turn around and we look at the left side of the heart, we're going to see left atrium in this region, and just inferior to that, the left ventricle. So we have described the atria as receiving chambers, and so they're going to be responsible for receiving blood back from the body. And so the right atrium is going to receive blood from the body through 3 veins. And I'm going to highlight these in blue because that's typically how we look at them. So we've got superior vena cava, and inferior vena cava that are going to drain into the right atrium. And so if we look at the image here, we can see these vessels. So here, coming from the top, this is going to drain venous blood from the head and the upper extremities. This is superior vena cava, and I can come in and I can flat color this a blue color. So superior vena cava. If we come down from the inferior aspect, this is our inferior vena cava, draining venous blood from the torso and the legs, all heading into that right atrium. And then our third vessel is going to be the coronary sinus. And this is actually draining venous blood from the heart itself through the coronary circulation. So if we actually turn our heart around, so we're looking at the posterior aspect of it, you're going to see this small vessel here. And this is the coronary sinus. I'm going to flat color that blue as well. And that's draining venous blood from the coronary circulation back to the right atrium. So here are 3 vessels that are draining venous blood to the right atrium. Now, the left atrium is a receiving chamber as well. And so if we turn around and we look at the left atrium, we can see that it's going to receive blood as well. And so if we take a look at those vessels, and I'm going to highlight this in red, because the left atrium is receiving blood from the lungs. And so this is now going to be oxygen-rich blood because it's already been through the pulmonary capillaries, and it's going to receive blood through 4 pulmonary veins that are going to drain into that left atrium. So if we take a look at what we have here, if we look at the heart from the posterior aspect, what we're going to see is this is our left atrium here, and we've got 4 vessels that are going to drain into it. So if I look at this side, here's a inferior pulmonary vein that's bringing blood from the left lung, and I can actually take that and I'm going to flat color it red. And then just superior to that, we're going to see a left superior pulmonary vein, both of these draining blood from the lungs back to the left atrium. Now, if we look at the right side of the atrium, we've got right pulmonary vein. So here's an inferior pulmonary vein. Oops. Inferior pulmonary vein, and then if we go superior to that, we're going to have the superior pulmonary vein. So this is a posterior view, and we're going to see left and right pulmonary veins draining into that left atrium. So let's talk about some of the structures that are related to the ventricles. We know that the ventricles are described as pumping chambers. And so they're going to be responsible for pumping blood from the ventricle out through a vessel. So let's talk about right ventricle. Here we have right ventricle on our high resolution heart, and we can see that we've got a vessel that's leaving that right ventricle. So what we see here is the right ventricle is going to pump blood into the pulmonary trunk, and this is deoxygenated blood. So this is blood that's heading to the lungs. Pulmonary trunk is going to end up bifurcating into a left pulmonary artery and a right pulmonary artery. And these guys are going to head to the lungs where they're going to pick up oxygen. Okay, so at this point we have got deoxygenated blood that's leaving the heart. And so if we can highlight on our image here, here's our pulmonary trunk. that's leaving the right ventricle. And then that pulmonary trunk is actually going to bifurcate into our left pulmonary artery that's going to send blood to the left lung. And we can actually kind of twist around a little bit here. I'm going to flat color all of these structures blue because they're carrying deoxygenated blood to the lungs. And so you can see at this point how we've got pulmonary trunk traveling up and then a bifurcation. And we're heading to left lung. And then on this side, we're coming behind the aorta and we're heading to the right lung. Okay, so that's going to be that bifurcation of the pulmonary trunk. Now, the left ventricle is responsible for pumping blood as well. Now, what it's going to do is the left ventricle, on the left side of the heart, we actually have oxygen-rich blood. Okay, so on this side, we've got blood that's already been to the lungs, and now it's heading back again. And the left ventricle is going to pump blood out through the aorta. And so this is the largest artery in the body. And if we look at our heart here, this structure here is going to be our left ventricle, and leaving the left ventricle is going to be the aorta. And so that's going to be here. And what I'm going to do is flat color that red because it is carrying oxygenated blood, and the aorta has several different segments. And I'm going to go through and color all of those red so that you can see that. So here is aorta leaving the left ventricle. We have aortic arch where it's going to kind of bend across and then start traveling down the thoracic cavity. And so those are the vessels that are leaving the ventricles. So let's take a peek inside the heart and look at some of the internal structures that we can see. So if I take my high resolution heart image, and I'm going to use my clipping tool and make a cut so that we can see inside the heart. So there we go. We can see at this point our 4 chambers. So we have right atrium, right ventricle, left atrium, and left ventricle underneath. Okay, some structures that we can see on the inside here. In that right atrium, you can see folds in the walls of the atrium. And these are called pectinate muscles. And so pectinate muscles are going to be found inside the right atrium. They're muscular folds that we see in the wall. We also have them in the left atrium, but they tend to be only present in the auricle on the left side. But those are pectinate muscles, and so those are going to be the muscular folds. Another interesting landmark that we can see when we do a frontal plane section of the heart like this is the interatrial septum. And so this is going to be the wall that separates the right atrium from the left atrium. And so that's going to be this structure right here. This is our interatrial septum separating the 2 chambers. Now, some other structures that are important. If we come down to our ventricles, we have a very similar setup. So we have an interventricular septum, and septum means wall. And so we're going to see the same thing here in the ventricles. So we're going to have this interventricular septum that's separating the 2 walls of the ventricles. Another interesting thing to notice with the ventricles is if you look at the left ventricle, look at the thickness of this wall on the left side as compared to the thickness on the right side. And so that's basically muscular hypertrophy of the muscular layer of the heart tissue because that left ventricle is pumping out blood against a greater resistance. It's got to pump throughout the whole body. So some other interesting structures that we can see in the ventricles are trabeculae carnae, and these are going to be muscular folds in the wall of the ventricles. And then we're going to have certain areas where that the walls of the ventricles kind of extend or protrude into papillary muscles. So each ventricle tends to contain about 2 or 3 papillary muscles, and these serve as attachment sites for chordae tendineae. They help to anchor the valves. So let's take a look. If we look at the ventricle, you can see the muscular folds in the wall of the ventricle, these in the wall of the ventricles, and they would be trabeculae carnae. Now, you can see in certain areas where those muscular folds protrude. So here, they serve as an attachment site for chordae tendineae, or those heartstrings. So indicated in blue here would be papillary muscles. In the heart, we have 2 sets of valves. One set is called the AV valves, or atrioventricular valves. And these are valves that are located in between the atria and the ventricle. On the right side of the heart, we have a right AV valve, otherwise known as a tricuspid valve. And I'm going to take this image and I'm going to flat color the tricuspid valve so that we can see it more clearly. So here's your tricuspid valve. It has 3 cusps as part of its valve, and it's anchored to the papillary muscles in the ventricle by these strings called chordae tendineae. And so these are collagen strings, and they're basically going to anchor the cusp of the valve to the papillary muscles. This is important because when the ventricles contract, the papillary muscles themselves contract, and they're going to hold the chordae tendineae taut to prevent the cusp or the flaps of the valve from everting into the atria under the pressure that the ventricles create. We see the same setup on the left side of the heart with the left AV valve, otherwise known as the mitral valve or bicuspid valve. It also has chordae tendineae, which I will color so that we can see them, and they are also anchored to papillary muscles in the left ventricle. Our second set of valves are the semilunar valves. And so these are valves that are going to be found between the ventricles and the vessels that are leaving each ventricle. We have 2 semilunar valves. They act as a pair, and they are called the pulmonary semilunar valve, that's located between the right ventricle and the pulmonary trunk. And then we have the aortic semilunar valve. And this is going to be located between the left ventricle and the aorta that's leaving the left ventricle. Okay, so let's take a look. I can use my clipping tool, and I can cut across the top part of the heart. We can turn it so that we can look down into these vessels. So what we see, and I'll circle these vessels, here's our pulmonary trunk. It's going to be circled in blue. And then this vessel right here is the aorta, looking at it from the top. And what we can see as we look down into these vessels are valves that are located within the vessel. So the pulmonary valve is going to be located in the pulmonary trunk, between the pulmonary trunk and the right ventricle. And then the aortic valve is going to be located in the aorta, between the aorta and the left ventricle. Okay? One of the things to notice about these valves is that they do not have chordae tendineae, and this is really important. So Atrioventricular valves do have chordae tendineae. Semilunar valves do not. Not the way that they're arranged, but they still prevent blood flow from going backwards. So we have ventricular contraction, and the blood has to go somewhere. So we don't want it to go back up into the atria. So the next place for it to go, or the most logical place, is going to be blood flowing from ventricles into either pulmonary trunk to head to lungs, or aorta to head to the body. Okay? And that's what we want to happen. So we have valves that are going to control blood flow there too. So we have a pulmonary semilunar valve and an aortic semilunar valve. So as we build up pressure in the ventricles with ventricular contraction or ventricular systole, that pressure is going to push the valves open so that blood is allowed to flow into pulmonary trunk and into aorta. Now, once the blood is in the vessel, the aorta or the pulmonary trunk, we don't want it to go back. So we want to prevent backflow of blood into ventricles. And we do that by closing the semilunar valves behind the blood. And the way that these guys are arranged is they're basically like little cups. And so as the blood pushes back against them, they close. They don't need chordae tendineae the way that they're designed. They don't need the heartstrings, but they do close behind the blood, and they, are designed to prevent blood from flowing back into the ventricles. Okay, and so in this way, this is how our valves work to make sure that blood flows in one direction throughout the heart. It creates a more efficient blood flow. Okay, one of the things I want to point out here, I think we talked about this before, but the thickness and walls of the left ventricle versus the right ventricle. So this is the heart here. This would be my right ventricle on this side. So here's right. This would be my left ventricle here. Look at this wall thickness. Look how nice and thick this is. And why is that? Because that left ventricle has to pump blood through the entire body. It has to overcome a greater amount of resistance. Right ventricle is only pumping blood to the lungs. It doesn't have quite as much resistance, so decreased resistance in comparison. Cardiac muscle hypertrophies, just like other muscles in your body. So that's what we see here. We see a hypertrophy of the myocardium as a result of the left ventricle pumping out against a greater resistance. It is not because it pumps a greater amount of blood. The amount of blood is the same. Okay, so same volume of blood is pumped out by each ventricle with each heartbeat. Okay, it's just that it's pumping against a greater resistance because it's got to get that blood to the entire body, and that's why we see thickness on the left ventricle. And that's one way that you can tell when you dissect a heart. You can identify one side versus the other. Okay, so here I've given you a couple slides of blood flow through the heart, and this is something that you do need to be familiar with. So let's kind of walk through this. Number one would be, this is superior vena cava. So we've got blood returning to the heart through the superior vena cava and inferior vena cava, right? It would head, in fact, you know what we can do is we can write this out. So one would be superior vena cava and inferior vena cava. Number two would be right atrium. Number three is going to be right ventricle. And we know that as we pass from right atrium to right ventricle, we are traveling through the right atrioventricular valve or tricuspid valve. Number four would be pulmonary trunk. Okay, and we know that in order to go, so let's put a star here, we know that's a valve. And here we have a valve controlling flow going from right ventricle to pulmonary trunk. We've got pulmonary semilunar valve. Pulmonary trunk is going to then bifurcate into left and right pulmonary arteries, and that's indicated by number 5. So left and right pulmonary arteries. Okay, and so that's here. Left pulmonary artery going to the left lung, so left lung would be on this side. Here's coming back through here. Here's our right pulmonary artery going to the right lung, which would be on this side. Okay, blood's going to perfuse through the lungs. It's going to pick up oxygen, and now we've got to get it back to the heart. And we do that through left and right pulmonary veins. So each side is going to have 2 pulmonary veins that return blood from the lungs back to the heart. So here's our left pulmonary veins. Here's our right pulmonary veins. So left and right pulmonary veins. Okay, blood's going to be carried or returned to the heart by the left atrium. So left and right pulmonary veins are going to return blood to the left atrium. It's then going to flow into number 8 here, which should be left ventricle. And we know there's a valve there that's also controlling flow. So left AV valve or mitral valve or bicuspid valve there. Okay. From left ventricle, we're going to pump blood out to the aorta, which would be number 9 here. And blood would flow to all the tissues in the body. Now, this is also a location of another valve here between left ventricle and aorta. So there's our aortic semilunar valve. Okay, so we have basically 4, areas here where we've indicated valves. So between right atrium, right ventricle, between right ventricle and pulmonary trunk, between left atrium and left ventricle, and between left ventricle and aorta. Okay, so certainly knowing blood flow through the heart. For example, if blood is in the right atrium, which chamber is it going to head to next? And so that would be the right ventricle. Okay, and realizing too that blood on the right side of the heart is going to be this on this side of the heart is all going to be oxygen poor. So this is all oxygen poor blood. It hasn't gone to the lungs yet. But if you look at blood on the left side of the heart, everything on this side of the heart is going to be oxygen-rich blood. Okay, so oxygen-rich on the left side of the heart. Because at that point, it's already been to the lungs. Okay, so a couple different ways. Here you've got it spelled out too, so certainly knowing that. So let's talk a little bit about coronary circulation, which is blood supplied to the heart muscle itself. And so what we see here are, the heart is filled with blood, but its walls are too thick. It doesn't get its nutrients from the blood it contains, so it needs a separate blood supply that supplies it with the blood that it needs. So we have coronary arteries, which actually branch off of the aorta and supply the heart with oxygenated blood. Okay, so these are arteries, so they are going to be oxygen rich. Some main ones here, I'm going to come here. Here's our arteries on this side because they're in red. So here are coronary arteries. Okay, your main ones that you're going to have, here's our aorta. And so branching off the aorta, we have the right coronary artery, which is going to branch off and travel along the right side of the heart. And it's traveling through the coronary sulcus, which is going to be this groove in between the atrium, right atrium, and the right ventricle. Okay, so that's going to be in the coronary sulcus or the atrioventricular sulcus. right coronary artery. We also, as you can imagine, if we have a right coronary artery, we would also have a left coronary artery, and we do. And so we've got this guy here that's coming off. So left coronary artery that's traveling in the left coronary sulcus. And then it's going to send off a branch that travels down. And this is a really important one. This is the anterior interventricular artery. Anterior interventricular. So anterior means it's on the front of the heart, and interventricular means that it's traveling in the interventricular sulcus between the two ventricles. Okay? This artery is also called the left anterior descending. And I've got this here. Anterior interventricular artery, also known as the LAD, the left anterior descending, also known as the widowmaker, which sounds pretty ominous. And it is because if you end up having a heart attack or some sort of blockage in these vessels up here, you could have a blockage, say, here, you could have a blockage here. It basically knocks out this entire part of your heart and can be very, very devastating and very deadly. So they call, if you have a blockage of the left anterior descending, they call that the widowmaker. And I have posted a video about that. It's actually really cool, so I would highly encourage you to take a look at that. It's on Moodle, but it talks about blockages. When they happen here, it basically knocks out blood flow to the entire left side of the heart. You can't pump blood to the body. It basically ends up in death. So not good at all, but there's your left anterior descending. And then, as you can imagine, we do have a posterior interventricular artery as well, which is going to travel through or branch off of the circumflex artery, which is going to travel around to the back of the heart here, and then send this branch down on the posterior aspect of the heart. Okay, and so that's what we have here. We talked about left coronary artery, which is then going to travel around and create circumflex artery, anterior interventricular artery, right coronary artery, and the posterior interventricular artery. Okay, here's a couple landmarks. The coronary sulcus, otherwise known as the atrioventricular sulcus. You'll see it listed as that as well. And that's going to be this area here, this groove in between the atria and the ventricles. And we have the same thing going on this side where the coronary arteries are located. And then the anterior interventricular sulcus is this external landmark here between the two ventricles. A sulcus is a groove. Okay, and usually it's a groove because something lies in it, and so this creates a groove in between the right ventricle and the left ventricle for that anterior interventricular artery. Okay, just notable too, the anterior interventricular sulcus is the external landmark. What's happening on the inside of the heart is this also shows you where the interventricular septum is. If you remember, that was the wall between the two ventricles, and it all lines up. That's what that, if you looked on the inside, that would be the septum. On the outside, you see the groove or the sulcus. Okay. In terms of coronary veins, so the heart's going to use up the oxygen in the blood, and then it needs to return it to the heart so that it can go to the lungs and pick up more oxygen. But so we have a coronary vein system with a great cardiac vein, which is located in the anterior interventricular sulcus, which is here, anterior cardiac vein. We have a posterior cardiac vein, a middle cardiac vein in the posterior interventricular sulcus, and then a small cardiac vein. The venous side of things, we tend to have a lot more variability So increased variability with the veins in terms of where they're located and that sort of thing. It is important to note here that all the veins are going to drain into the coronary sinus, which is on the posterior. I had a picture of it, but here. Coronary sinus on the posterior aspect of the heart. All the veins are going to drain into that. Let's clean this up a little bit. Okay. So all coronary veins drain here into the coronary sinus, and then the coronary sinus is going to drain into the right atrium. Okay, so if you remembered, we had 3 vessels that drained into the right atrium. So we had superior vena cava, we have inferior vena cava, and we have coronary sinus. Okay, so here's our coronary sinus draining into the right atrium. So it basically collects all the venous blood from the heart itself and routes it back into that right atrium. Okay, so what's interesting to note with the coronary circulation is that it can be highly variable, and what can happen too is that if you have a slow progressive blockage, you can actually grow new blood vessels to supply that area. Our heart tissue is very unforgiving. It's highly dependent on oxygen, and it does not regenerate. So once you kill your cardiac muscle, it basically scars. Okay, so it does not regenerate. So if you have a slow progressive blockage, you actually have the ability to grow new blood vessels so that you can supply that area with blood, and we call that angiogenesis. Okay, in fact, I think it's angiogenesis. It's like creation of new blood vessels. But if you have a sudden acute blockage, you don't have time to grow those new blood vessels, and that can be very devastating, and that's what we would call a heart attack. So if you have just a transient lack of blood to the myocardium, to the muscle layer of the heart, which would otherwise be called myocardial ischemia, you can end up feeling chest pain due to that. And so these patients, you might see this with overexertion, so maybe somebody's out like shoveling snow or they're walking up a hill, they might say, oh, my chest hurts. And that's because the myocardium has increased oxygen needs, but they don't have enough blood supply to that area to supply that tissue with the oxygen that it needs. And lack of oxygen, ischemia, is basically a decrease in oxygen or a lack of oxygen, and it's actually very painful. And so that's what creates that chest pain. So we call that angina pectoris. And patients will sometimes take nitroglycerin for that. That's a medication. And they'll usually do it sublingual, which means that they put it underneath their tongue. It's a vasodilator, and it will help to decrease angina or chest pain. Now, another instance of this is myocardial infarction, and this is actually where you have death of cardiac cells due to lack of oxygen. So this is otherwise known as a heart attack. This is not good, and I'm kind of ask you here to think about damage to what area of the heart would be the most serious. Certainly the left side of the heart would be very serious, and that's kind of pulling in that left anterior descending and left coronary and circumflex arteries, because if we can't get blood out to the whole body, then we are certainly in trouble. Okay, and so this is showing you here a myocardial infarction where you have actually death of cardiac muscle cells. But if we have a blockage and blood can't flow to that area, then any tissue that's being supplied by that vessel could die. This is showing you an angiogram, and so this is how they would look at this. Um, they would inject dye into the blood vessels and look at the blood flow. So this looks nice and open. This certainly looks like an area of stenosis, which is narrowing of the blood vessel. And so you see that going on there. This is an area of myocardial infarction. So you can see that area right there where it's basically scarred down for that tissue. So how do they treat this? Well, they do a coronary artery bypass surgery. We call these CABG, coronary artery bypass grafting, where they actually would harvest a vein, typically a large vein in your leg that's really superficial, and they're going to go in and cut that out, and then they're going to attach that, routing it around the blockages. So let's say here you've got a blockage here. Well, we can take this new artery and feed it from aorta or a branch off of aorta and travel it down a little bit past the blockage, and so now it can feed, that area of the heart that was formerly being supplied by this area that's now been blocked. So that's a coronary artery bypass grafting. Typically you'll see, like in a patient's chart, CABG times 4, or maybe CABG times 2, and that means that they had 4 bypasses, or they had 2 bypasses. So this is pretty common. This is what it used to look like when I first got out of school, like 20 years ago or something. It was huge incision. I mean, they would cut from all the way here, all the way down, past their ankle, and they would take out that saphenous vein and put it in as a bypass. But now it's a lot better now. They do it endoscopically, so they just do some little cuts down the leg, and they still harvest the vein, but they don't have to have that huge incision.